People that have diabetes are also at risk of recurrent yeast infection. What's up, beautiful people? Welcome to another exciting episode of Health Savvy with Dr. O. You already know, yeah. And as usual, I'm excited to have you guys here with me on another exciting episode of Health Savvy. So today I'm going to be talking about something very interesting, as always, because I never talk about boring topics. But this particular topic is inspired by you. I got a lot of DMs, a lot of messages, requests saying, talk about this particular topic. And I'm like, there's so many people actually, dealing with this topic, right? So of course, your wish is my command. I will always do what you request and what you tell me to do, because this show is specifically for you. Let's jump right into the topic of today. So today we're talking about vaginal yeast infections, also known as vaginal candidiasis. Yeah, that's a big word. So basically, what is a vaginal yeast infection? Has this happened to you before, or have you heard it before, where all of a sudden in your private part area you're just itching, scratching, and even in public you're like, hey, if I start scratching now, people will be like, what's wrong with this girl or something? Maybe they'll think I didn't shower today, or I have hygiene issues or something, so you don't want to scratch and resist to scratch yourself. Yeah, it can be really, really uncomfortable, and apparently a lot of people are really dealing with it. I see this in a lot of patients, right? And also in a lot of even friends and stuff like that. It's very common amongst women. Now in this video we're going to be talking about vaginal yeast infections, what causes it, symptoms that you might have, how to prevent it, and then of course we'll talk about treatment and every other thing that you need to know basically. So first of all, you need to know that vaginal yeast infections are caused by something called fungi. Fungi are microorganisms, right? And they like to grow in moist environments. So yeast is a type of fungi. So have you seen when you left bread or maybe some kind of food and you left it out of the fridge, you just left it on the table for days, maybe you forgot it there, and you just come and you see like things people call mold growing on it? Yeah, mold is like a type of fungi. So basically that's how this yeast infection is. It's fungi. They like moist environment, they like damp environments, right? They don't like areas that are dry. And the vagina is a moist environment, so it's easy for fungi to grow there. Vaginal yeast infections are caused by a fungi called Candida albicans. That's why it's medically called vaginal candidiasis, right? So caused by Candida albicans fungus. The vagina has its natural flora. So natural flora means microorganisms that are present in the vagina, but in the right concentration. So we have fungi, we have bacteria, but they all coexist in the right amount, and they are there to protect your vagina. The problem now happens when there is a disruption in the balance of these microorganisms. That's one of the causes. So for example, a disruption can happen when you abuse antibiotics. So for those of you that any small thing that is wrong with you, you just assume you have infection, you go and taking antibiotics anyhow. You go to chemists will give you antibiotics. You don't know that you are actually doing more harm than good for yourself, because a lot of times when something is wrong with you, it's not always an infection, and even if it's an infection, it's not always a bacterial infection. And antibiotics only work for bacterial infections. They don't work for viral infections. So for example, if you have catarrh, take antibiotics or you want, catarrh is not going to go away, because catarrh is caused by virus, right? Flu is caused by virus. So don't abuse antibiotics. Always go to your doctor, right? Let your doctor prescribe drugs for you, and if you need antibiotics, your doctor will prescribe the right antibiotics for you. If you abuse antibiotics, so just go buy antibiotics, take them, use anyhow, use every single time. Some people use antibiotics almost every month. They are on one antibiotic or the other for reasons best known to them, right? So you are actually harming your vagina. You are disrupting the natural flora, that is the concentration of microorganisms in the vagina, and you are going to expose yourself or put yourself at risk of candida infection, because when you use antibiotics to kill all the natural bacteria in that your genital area, guess what's going to happen? The fungi is now going to become king. They will start spreading and multiplying and occupying all the space that bacteria should be occupying. So you now start having itchy. Everywhere is going to be itching. And then, okay, I'm going to talk about the symptoms later. Let me not go into symptoms, but itching is one of the major symptoms. Another thing that can cause you to have vaginal yeast infection is when you do something called douching, whatever the pronunciation is. So you just get all these douching fluids and everything, and then you now start saying, so people will say, I have to wash the inside because it has to be clean. Hello, the vagina is self-cleansing. You only need to wash the vulva area and the outer part of your genital tract. You don't need to put your finger inside and say you are washing something with soap. No, you are destroying the natural flora, right? And you are changing the pH. So pH is acid-base balance of that place. And when you change the pH, it disrupts the natural balance of the microorganisms there, right? Because they need a certain type of pH to coexist or to survive there. So by douching, you are just messing things up basically. You're just capturing everything, right? And then you're exposing yourself, like I said, putting yourself at risk of yeast infections. There will now be fungal, what we call overgrowth, and then you start having all the symptoms of yeast infection. So that's one of the things. I talked about antibiotic abuse. I talked about douching. Another thing is pregnancy. Because pregnancy also there's also a change in hormones and all that. So pregnant women are more susceptible to having vaginal yeast infections, right? Because of all the changes in their hormonal balance and all that. So this is not unusual. We see this a lot in pregnant women. People that have diabetes are also at risk of recurrent yeast infections, right? So in case you are diabetic, you might be dealing with this problem a lot. So just discuss with your doctor. That's one cause. And another cause is people that have impaired immune system. So for example, if you have HIV and your immune system is not able to fight infection, you are more at risk of having vaginal yeast infection. Another factor is if you are on some form of hormonal therapy. So if you're taking oral contraceptive pills or any other hormonal therapy, right, this can also put you at risk of vaginal yeast infections. Wearing damp underwear, right? So for example, if you went to swim, you leave your swimsuit on, the wet swimsuit, but you are wearing it on forever. Or let's say you walked out and you sweated a lot. You know, this kind of workout, you do a lot of cardio, jogging, running, and you are sweating, and your underwear is soaking wet. And then instead of you to change that underwear, you leave it on and continue to wear it. Remember I said fungi likes damp and moist environments, right? So you are making the place habitable, comfortable for the fungi to grow and just be multiplying. You know, fungi is just there and it's being fruitful and it's multiplying inside your underwear in that area, right? Trust me, you don't want that. So that's one of the things I can consider. Then tight fitting underwear and tight fitting clothes too, right? For example, if you are sweating in that area and it gets damp, right? So when it's tight fitting, the moisture and the dampness, you are actually promoting the growth of that fungi. So now that we've talked about the causes, let's talk about prevention, because of course everything that has a cause, now that you know the cause, you are able to prevent it. Number one, I said antibiotic abuse. So because you know that if you abuse antibiotics, you are putting yourself at risk of vaginal yeast infection, then you need to stop taking antibiotics that nobody prescribed for you. Stop taking antibiotics anyhow. It is not sweet. It is antibiotics. They are serious, important drugs that you don't need to be abusing, okay? So please, let me just stop there. Stop taking antibiotics that nobody prescribed for you. Number two, douching. It is not necessary to use all this vaginal douching gel, douching scrub, douching anything and wash inside. If you are cleaning anything, it's the outer area, right, the vulva area and all that. But you see that inside, the moment you have to use your finger and put your hand inside somewhere, then just know that you're going too far. Vagina is self-cleansing. You don't need to put your hand inside to clean anything, right? So that's number two, avoid douching. Then three, avoid tight fitting underwear. But then again, if you go for a workout, you go for swimming and your underwear is wet, it's a good idea to change it to something that is dry, because you want that genital tract area to be dry all the time so that you're not giving fungi the environment, the conducive environment it needs to actually grow, right? You want to make it impossible for fungi to survive or to multiply. So yeah, making everywhere unbearable for them, right? By wearing dry, absorbent underwear. Now that we've talked about the causes and the prevention, let's now talk about the symptoms. How would you know if you have vaginal yeast infection? So like I already mentioned earlier in this video, the number one symptom is itching. Itching in the genital area, not itching in the body. Obviously, we're talking about vaginal yeast infections here. So you just notice that area is just unusually itchy. And you're like, why am I just scratching like this? And you just scratching in this gene. That time it becomes unbearably itchy and you just scratch. And of course, the itching will now lead to soreness, because when you are scratching that place, it's now going to be sore. And sometimes it's now red, right? And it's just totally uncomfortable. So that's one of the symptoms. Another symptom is when you have burning pain when you're passing urine, right? Because your urethra, so the place where urine comes out, is in that area. And of course, when you urinate, sometimes it touches parts of the vulva that are already sore. So you have burning pain, right, when you pass urine. Another symptom is when you have discharge. So this is a characteristic symptom. Both itching and discharge, they are major symptoms of vaginal yeast infection. So when you see that you have discharge, so normally during your cycle you might have discharge, right? But this discharge is a bit different from your regular vaginal discharge. This one is whitish, so it's a really whitish color, right? And then sometimes it has something that we call a cottage cheese appearance. So I'm going to put a picture somewhere here so that you can see what it looks like. So it has a cottage cheese appearance and is whitish, then associated with itching. So when you have those kind of symptoms, there is a high chance that you have a vaginal yeast infection. Another symptom is a vaginal rash. So sometimes you will notice a kind of rash in the vaginal area, around the vulva area, right? And that rash is causing itching. Is another symptom of vaginal candidiasis. Vaginal candidiasis, one of the symptoms is also painful intercourse. So it can also cause you to feel pain while you're having sexual intercourse. So how is your doctor going to diagnose this? If you just notice you have any of these symptoms and you feel it's not normal, right? Best thing is to go to the hospital to get checked. Like I always say, don't self-diagnose, don't prescribe medications for yourself, right? Go to the hospital and get checked, and then the doctor will probably ask you about your symptoms and everything, and then take a sample of that your vaginal discharge that you're having, send it to the lab for testing. So if it's actually a yeast infection, then the results will come out saying so. And there are many treatments available. Sometimes they give you pessaries that you can insert into the vagina. So this is one time when you're allowed to put your finger, not when it's time to douche. You can put your finger to insert the pessaries, right? So you might have to use it for like a week, right? Some pessaries it might be 5 days, but most of them it's usually 7 days, right? So you need to only insert it, and it's usually at night, so it's just once at night you insert it, and after 7 days it's gone, right? For some people they might just prescribe an antifungal medication for you, so tablet to use, and tell you that's fine. So but if you notice that you are having recurrent yeast infection, so you're having more than 4 in a year, because yes, these infections are common in women, but when it's becoming too frequent, then there might be a problem. It's either the previous one was not properly treated, or you are dealing with a complicated yeast infection, and that you need to speak with your doctor about, so that they're giving you the appropriate medications. When it becomes complicated, you might need long-term therapy or alternative medications apart from just the vaginal pessaries. So we basically talked about what it is, we talked about the microorganism that causes it, we've talked about the things you do to put yourself at risk, so risk factors and also causes. We've talked about how you can prevent it, we've talked about symptoms you have so you can identify if you have this infection, and of course we've talked about what you need to do if you notice you have these symptoms, right? Not self-diagnose, not treat yourself, go to the clinic to get tested, so that if you really have it, it can be treated. If you enjoyed this video so far, don't forget to click the like button, and if you haven't subscribed yet, what are you waiting for? Please click the subscribe button down below, and don't forget to share this video with anyone that you think needs to see this. If you have any video topic requests, feel free to comment down in the comment section below about what you want me to discuss in later episodes, or send me a DM on Instagram or to my mailbox. Remember, a healthy you is a happy you. See you next week.